Welcome back, everyone, to TV5 News at 9. More than 70,000 Americans were diagnosed with head and neck cancers in 2024. And these cancers are more than twice as common in men as they are in women. Joining us this morning to tell us more about an exciting treatment option, we have Dr. Hani El-Halaby. Dr. Halaby, thanks for being here. How are you?
Good. How are you? Thanks for having me.
Of course, we love having you. Can we start us off by telling what are the risk factors for head and neck cancers?
Yeah, that's a great question. There's actually a number of risk factors, and I can put them into two categories. There are some lifestyle risk factors, and there are some virus risk factors in this category of cancers. The lifestyle risk factors are smoking, tobacco in general. So even chewing tobacco can increase someone's risk of getting a head and neck cancer, and alcohol consumption. So alcohol abuse can also increase your risk of having a head and neck cancer. On the viral side, there is a virus called the human papilloma virus. It's the same family of viruses that cause warts. A lot of people are familiar with warts. In that group of viruses, there are some strains that are known to increase or cause squamous cell cancers of the head and neck. And there's also another virus called the EBV virus, Epstein-Barr virus. We know it as the cause of mononucleosis, mono. That's also a virus that can cause cancers in an area of the head and neck called the nasopharynx. There are some other factors, like you said, males do have a higher rate of these cancers, so that technically is considered a risk factor. But ultimately, I think we talked about the most important ones.
Very good. Thank you for laying that out. Can you tell us the warning signs or maybe screenings that people should know about regarding these cancers?
Yeah, right now there isn't any clear defined screening guidelines. The symptoms and the way these cancers present can really vary depending on where in the head and neck the tumors or the cancer forms. But a lot of these cancers do very often go to the lymph nodes that are in our neck. So we have lymph nodes on both sides of our neck. And when these cancers spread to the lymph nodes, they usually present as a growing, painless lump in the neck. And I think that's a very important thing to look out for in patients who develop that. So other things you can usually see is in patients who have tumors in the mouth, you can have non-healing sores or ulcers that keep getting worse, bigger, hurt. That's a warning sign. Sometimes patients also present, especially patients with throat cancers, with new trouble swallowing and changes in voice. We are also seen in patients who have cancers of the voice box. And there are other less conspicuous symptoms like blockage of the ear, feeling like the nose is blocked, bleeding from the nose, many symptoms. I think a lot of them are the kind of things that if you develop, you should touch base with your family physician and discuss them further, because a lot of times you can get these symptoms because of benign issues, infections, but ultimately it's all about the timeline and them getting worse and not improving with your normal standard management like antibiotics, anti-inflammatories, things like that.
Very good. Yeah, good to check in with your doctor always. So, doctor, radiation is often a treatment option for head and neck cancers. McLaren, though, operates one of only 2 proton therapy centers in the state. Can you tell us how proton therapy is different from that traditional radiation therapy option?
Yeah, absolutely. So traditional radiation, we call it photon radiation. It's basically X-rays. So I think everybody knows that when you go for a chest X-ray, the X-ray just goes through and through. So it goes in the front, comes out on the back. You can't stop a beam of X-rays at any point in the body. But with protons are a charged particle, and a beam of proton, we do have the ability to stop the beam of proton at a certain depth inside the body. So if you have a tumor at a certain point inside the patient, you're able to deliver a beam that stops at the end of this tumor, and it really helps spare tissues that are beyond that tumor from getting the low-dose radiation that can sometimes be responsible for some of the side effects we see with photon radiotherapy. So it just helps you conform and pinpoint the radiation more accurately and help minimize radiation to the normal tissues and organs around what we are trying to treat.
McLaren Proton Therapy is actually taking part in a clinical trial for head and neck cancers. Can you share some of the findings that you're seeing?
Yeah, so this is actually very exciting because we do now have a randomized phase 3 clinical trial that was done in patients with oropharyngeal cancers. These are cancers of the throat, like the tonsil cancer, base of the tongue cancers. And it was a first study randomized that has been now published showing a benefit in terms of toxicity for patients that were treated with protons. Let me give you a little background. Nutrition is one of the biggest challenges we face in managing patients with head and neck cancer. You can imagine tumors are growing in the throat and the mouth, and then the treatment all can impact your ability to eat by either causing pain, changing taste, or making it difficult for patients to swallow. Mm-hmm. So that's always been a challenge, and we wanted to see, that study was really intended to see if the use of protons and helping spare the organs around where the tumor being treated can help decrease the potential impact treatment can have on swallowing and nutrition. So this study included more than 400 patients. Half of them were treated with protons and half of them was treated with intensity modulated radiation therapy, which is the more advanced way of delivering photon radiation. And they found that the patients who were treated with the protons had better chance of maintaining their weight at the end of treatment and needed less feeding tubes. And I think that's very, very important. It's very important for patients from multiple levels in terms of quality of life, psyche, that they are able to eat and be independent and not need a feeding tube. And I think that that's going to be a very important measure that we will use to push for patients to be treated with protons in the future when they present with these cancers of the oropharynx. Yeah. We're very excited about this data, and we're really happy that we have a tool now that can obviously impact patients' lifestyle and quality beyond just curing their cancer.
Absolutely. Yeah, it sounds very promising. Thank you for sharing. Can you tell us if someone is interested in learning more about proton therapy or maybe getting a consultation, how can they reach out to McLaren Proton Therapy Center?
Yeah, absolutely. I mean, we're always looking forward to having a talk with patients and discussing what we can offer and how we can help them. I think patients who are interested in speaking with us can call us. We have a number, 855-MY-PROTON. They can also look at the resources that we have on our website, mclaren.org/proton therapy.
All right, Dr. Al-Halaby, thank you so much for your time this morning. It is great to learn more about proton therapy. Thank you for sharing.
Thank you.
You're very welcome. You're very welcome. And for you at home, you can find more information by going to the hot links section on our website at WNEM.com.